8 out of 10 people in their life will experience back pain. And you've probably experienced back pain if it's either temporary or chronic. And we're going to be sharing our perspective on how fascia can manipulate the body and really be a major role in back pain and eventually chronic back pain. So we're going to be sharing our perspective and even a position in block therapy that you can do right now today to help relieve that area.
So the first thing we need to understand is, from an alignment perspective, we're like a building. We have foundations in the body that are designed to support our cellular structure. If we don't strengthen and support proper foundation, we tend to fall into that internal space in the body. And over a lifetime, it causes the fascia to twist, to grip onto bone with a crazy 2,000 pound per square inch force, sealing us and locking out of proper alignment, which creates challenges up the chain. And most importantly, when we're talking about back pain, we really want to understand how fascia winds around the calves and affects the alignment of the feet. So I just want to explain here for a minute, because when we are breathing diaphragmatically, which is part of our block therapy program and system, we turn on the internal furnace of the body. Now, the reality is most people are breathing through the muscles of the upper chest. So it's kind of like the diaphragm is the furnace. The muscles of the upper chest are more like a space heater. So we're not getting enough heat and blood and oxygen flow traveling throughout the body. So the further the fascia is away from the engine, the more frozen it is. And when we look at the lower legs and feet, the way the fascia will wind around the calves and push that ankle often into pronation. Some people supinate, but 90% of people pronate. That manipulates everything up the chain. So if you have back pain, going and having your back addressed may feel good in the moment, but it's not going to take away what's causing that back pain. Also to mention, at the very back, turn around quick for me. So right through here, the sacrum bone is here, and it's a triangular bone, and each side of this bone connects to the pelvis, and it's called the SI joint. So this allows the pelvis to swivel. Now, I'm not going to touch you there. The pubic bone.
Oh, the pubic bone.
Yeah, you can touch yourself there. The
right
pubic
here.
bone in the front of the body is the joint that is connected to the SI joint in the back. So we're going to actually show you a position so that you can melt the adhesions, because if your SI joint is out of alignment, so is the pubic bone. So there's one very simple exercise that we're going to demonstrate is going to help you release and realign that pubic bone. Now, this is just one thing to do. In block therapy, we address the whole body, and we start at the foundation once we get through our starter program and teach you the basics so that we can really bring that foundation into play. But even just doing this one position will help to take some of that strain off of that low back if SI joint pain is a common thing, or even sciatic pain.
And we talk a lot about the balloon analogy, and we're going to probably be using that for a lot of these videos to explain, because it really shares how cause sites and pain sites work. So when we're experiencing pain in the back, that's not the cause, as Deanna mentioned. So for example, when we are collapsed, just from a very simple perspective, when we're collapsed, it's causing the balloon to be gripped on one end and then expand in the other. So everybody wants to work on that expanded balloon inflammation pain area, but what's causing that's the grip. So with this position, we're going to be addressing that grip to help release that inflammation area. So ready?
Yeah, are you going to show them how to just roll that up so that they...
Yeah, so what you can do, this has worked pretty decently, especially just to start off as a mimic of a block here. All we have done is folded up a towel. So sure, you can figure out the best way for you to fold this up. All I've done is flipped it over one way, folded it this way, folded it back to this way, so it's going to look like this. And then all we're doing, actually this would make more sense going this way, we're going to roll it up really, really tight, and that will create a little bit more density. And then it will be more of a cylinder, but as you get into this position, it will squish down into more of a rectangular shape. So you can use this and position it directly over the pubic bone as Deanna guides me into this position. However, I will be using our tool, the Block Buddy. So directly on the pubic bone is where the block will be positioned. We did share the belly position. If you haven't done that one yet, I would recommend doing that one first. And then all we're doing is moving the block a little bit lower, so we're literally on that bone. So you're gonna have your towel horizontal like this. And then I'm gonna use that as a forehead rest. And then very slowly, we want to approach the block, and you might need to take your time getting on, finding that bone. We are literally on the bone, but understanding that fascia grips and hooks onto anything in the way, including bone. And we need to get deep to those layers to be able to release those grips and those cause sites.
So once you get into position, and great recommendation to first do the belly position before doing this, is we want to focus on that full conscious exhalation. So when we're lying in a prone position, we can use the instruction of, when we exhale, feel that the belly button is moving up toward the front of the vertebrae. So squeezing the belly small with the exhalation. And then when you inhale, the belly should be moving down toward the floor. That's accessing this diaphragm muscle, which improves oxygenation, which is key for rehabbing pretty much anything in the body. Oxygen is the most important nutrient we need to send to the cells. And for those of us that are breathing through the muscles of the upper chest, we are really diminishing our ability to oxygenate all of the cells in the body. So you'll likely experience some pain just by being here. And if you do notice that one side is pushing in with a little more pressure than the other side, that is your body letting you know that that pubic symphysis, that joint in the front, isn't properly aligned. So the goal is that we want to make this joint feel like it's flush, and that's going to help to release what's going on in the back. So we always want to remember to focus on that proper diaphragmatic breath. That is the key to internally heating the body, turning on that internal furnace. And if you notice how most people stand, people do not stand with both feet positioned properly. We did do a video also on rooting, discussing how to stand and sit properly. And yet most people are going to fall over to one side or the other because we're dominant on one side. So when I look at bodies, I always notice which one is the flat tire. Whichever foot is pronating more, which often is accompanied by a bigger bunion, that's going to be the leg that's going to be drawing away from the body, causing everything on the opposite side to be tense. So if you have pain in the right side of your back, for example, likely it's going to be that left calf and foot that are going to be the real drivers of what's happening, and equally true on the other side. So as you're getting into this, the goal here is that we spend at a minimum of 3 minutes getting deep to the layers of adhesions to create a melting effect. And then when those adhesions start to melt, blood and oxygen flow get pumped into the area through using our proper breath, and we start to regenerate. Our cells actually start to heal and rebuild with this work. And we need to be a minimum of 3 minutes because we can't rush melting. Think of having a block of ice. If you put your hands on that block of ice and you start rubbing, what's going to happen is your hands are going to feel like they're burning. If you place your hands on that block of ice and you let them rest, eventually you're going to start to melt through that block of ice, and you can slowly, really effectively melt that block as opposed to rubbing. So when we see people doing any kind of fascia work where they're rolling, you're basically staying on the surface layers, and our goal is to get right to the bone where the fascia will grip and adhere. So time is the key here, and we can't rush the melting process. Let's spend 1 more minute in position. Notice for yourself if you're starting to feel that the pain is less. The pressure fibers are larger in diameter than the pain fibers. So when we spend time in a position and we connect to the breath, the pain changes, as it should be for you. It becomes more of a good pain. And really all pain is a language that your cell is giving you to let you know that it needs some attention. And this is a wonderful way of giving it that attention. Let's spend 3 more full slow exhalations here. And if you can, always be breathing in and out through the nose. And it's always important that we connect the breath with movement. We often hurt our back when we lift something that's too heavy and we hold the breath doing it. We are asking the cells to work, yet we're starving them when we're holding the breath through movement. So let's practice by placing the hands under the shoulders and exhaling up and off the prop, whatever it is that you're using.
Okay. That got nice and deep.
Yeah? Did that feel like it made some changes?
Yeah, well, I used that real guy here.
This will also create some change too, though.
It 100% will.
Yeah.
I've been even playing around with the towel a little bit, and you can definitely feel some changes. So
Yeah.
play around with that. Let us know what you think. So that's pretty much everything for this video. If you have any questions, leave that in the comment section below. Of course, if you have any comments, leave them there as well. And make sure you like this video, subscribe if you want to see more of this, and make sure you hit the bell so you're notified every time we do upload more videos like this. So that's everything. Thank you for watching, and we'll see you in the next video.